Imagine trying to walk, reach for a cup, or even sleep, and every one of these movements hurts. Now imagine that pain never really goes away no matter what you do. And for millions of people, this is daily life until they get a joint replacement. So what exactly is a joint replacement and how can it change your life? I am Dr. Angela Mailis, and let's break things down. Why do joints wear out? Our major joints like knees, hips, and shoulders are meant to last a lifetime. But over time, things can wear down. And the most common culprit? Osteoarthritis. That's when the smooth cartilage that cushions your joints starts to break down. And without that cushioning, bones begin to rub directly against each other, causing pain, swelling, and stiffness. This breakdown can happen because of all the injuries from sports or accidents. Excess body weight that puts more strain on the joints, or simply genetics, as some people are more prone to joint problems than others. So when everyday activities like walking, reaching, or climbing stairs start to feel impossible, that's when joint replacement becomes a real consideration. If medications, manual therapy treatments, and lifestyle changes no longer provide relief, your doctor will recommend that you see an orthopedic surgeon to consider maybe joint replacement surgery. And that means removing the damaged parts of the joint, reshaping the bone, and adding artificial components, usually made of metal, plastic, or ceramic, that moves smoothly and comfortably. It's like giving the joint a second life. This can be done through traditional open surgery or minimally invasive techniques through a smaller incision, but that depends on the surgeon and your specific situation. Anesthesia is used so you don't feel pain, either full anesthesia or a regional block that numbs just the arm or the leg. Now, here is what really counts. What you do after surgery can determine how successful your new joint will be. Most people go home the same day or within 24 hours, and you will usually begin moving the joint within these first 24 to 48 hours, sometimes with a physiotherapist guiding you through the motions. Depending on the joint, you may use a walker, cane, crutches, or sling for support. But the real magic comes from progressive rehabilitation. And this is not just about basic movement. It's structured, step-by-step process designed to rebuild strength, flexibility, balance, and confidence. The better your rehab, the more your joint feels like you again. Skipping or underestimating this phase can lead to stiffness, reduced mobility, and a slower return to normal life. Think of rehab as your personal investment in how well you will move for years to come. Now, how long do these new joints last? The good news? Artificial joints today are built to last. In the 1970s, they lasted maybe 10 years, but today, over 85% last more than 20 years. But here is what matters most: your activity level, managing excess weight, and how committed you are to your rehab and long-term joint care. While you will need to avoid high-impact activities like running or martial arts, low-impact exercise like walking, swimming, or cycling is encouraged. Movement is medicine, and for joint replacements, it's the key to long-term success. Here are some key takeaways. Joint replacements are safe, effective, and common. Recovery starts fast, but real success depends on dedicated progressive rehab. With the right care, modern joints can last decades and help you reclaim your life. Managing your weight and staying active within the right exercises helps protect your new joint and extend its lifespan. Do you know someone who has had a joint replacement? What made the biggest difference in their recovery? Let us know in the comments. Like this video if you learned something new. Subscribe for simple, practical health information every single week. And we've got more episodes coming your way. See you in the next one.